Good evening, everyone. My name is Nicholas Santos. I am the National Immunization Program Medical Manager for Region IV-A CaLaBaRZon. First of all, in behalf of our office, we would like to thank the Philippine Pediatric Society for giving us the time and opportunity to present what the National Immunization Program is all about. For the following slides, we will be presenting the data of our fully immunized children or our accomplishments from 2017 to 2021. We're going to present the data of the first half of 2022, the comparison of the data of 2021 and 2022, and finally, issues and concerns which greatly affects our accomplishment, our fully immunized children, which later on, we are hoping that we can resolve the issues to be discussed. So to start with, what is fully immunized children? So as per Field Health Services Information System, or FHSIS, which is the main data system that we use, it is defined as an infant who received the following vaccines: 1 dose of BCG vaccine, 3 doses of OPV, 3 doses of pentavalent vaccine, 2 doses of MCV, where MCV1 is given at 9 months and MCV2 is given at 12 months. All of these vaccines given by 12 months old. So the target for our fully immunized children is at 95%. So this is a nationwide target. For the following slides, we will be presenting the data from 2017 to 2021. Last 2017, our region had a total fully immunized children of 63.3%. where the Laguna province bagged the highest percentage or accomplishment, and the Quezon province having the lowest. Last 2018, we had a total accomplishment of 58.5%, where the Laguna province again bagging the top accomplishment, and this time Rizal province having the least accomplishment. For the year 2019, we had a total of 74%, Laguna province at 80.8%, and Batangas province at 66.8%. Last 2022, we had 63.4%. This time, Cavite having the highest accomplishment at 82.5%, and Rizal province at 48.7%. And finally, last 2021, we had a total of 49.6%. Laguna again having the highest accomplishment, and Quezon having the lowest accomplishment. So the following is a line graph showing the progression of our accomplishment for the fully immunized children percentage from 2017 to 2021. So from 74% last 2019, we are down to 49.6% last 2021. Which is mainly due to the COVID-19 pandemic situation. So from all the provinces of the region, Batangas, Cavite, Laguna, Quezon, and Rizal provinces, we can see a downward trend from 2019 to 2021 in almost all of the provinces. For the Batangas province, its last FIC is 49.5%, where almost all of its cities had the lowest accomplishment, or second to the last lowest accomplishment, at the year 2021. So we will notice this on the other cities of the provinces. For Cavite province, the FIC for 2021 is 49.6%. So this is one out of the 5 provinces which does not have the downward trend from 2019 to 2021. So again, almost all of the accomplishments, we can notice the lowest accomplishments or second to the last lowest accomplishments in the year 2021. For the Laguna province, accomplishment for 2021 is 62.4%. Again, we can notice the downward trend from 2019 to 2021. Again, if not all, almost all of the accomplishments at 2021 are the lowest or second to the lowest. For Quezon Province, its FIC or accomplishment last 2021 is at 42.4%, with both cities having the lowest or almost the lowest at the year 2021. And for Rizal, its FIC last 2021 is 42.5%. So again, the downward trend from 2019 to 2021. And its city of Antipolo had its second to the lowest accomplishment in the last 5 years in the year 2021. So for our data for the first half of 2022, last January, we had a total of 3.65% accomplishment. For February, 3.77% accomplishment. 3.49% accomplishment for March. 3.36% accomplishment for April. 3.60% accomplishment for May. And 3.76% accomplishment for June. So this data was taken from our FHSIS as of August 15, 2022. So in order for us to achieve the 95% target, we should be able to have at least 7.9% monthly. So if we will notice the numbers, it is at least in the half percentage or slightly above the half percentage of the target, of the monthly target to achieve the yearly target, which is the 95%. Presented is a line graph showing the progression of the accomplishments for the year 2022. So our highest was at February, which was 3.77%, and we can notice an increase from April to June, which is mainly due to the Chikiting Vaccination Days campaign, or the catch-up campaign launched by the Department of Health Central Office. So this helped our accomplishment. So it increased from 3.36 to 3.76%, which is the second highest for the first half of the year. For our fully immunized children, for the first half of 2022, we had a total of 21.6%. The data presented in this slide shows the access or the Penta 1 coverage in percentage, which is at 27%, and the utilization, which are the children who received the Penta 1 to MCV2 in percentage, which is just at 23.66%. So with this data, we are included, or we are categorized in the category 4, which is meaning we are at a high risk. So the whole region is in high risk for having an outbreak. The following is a tool used, namely the measles risk assessment, where we use the total population. So this should be the total population, total eligible population, MCV1 coverage in percentage, and MCV2 coverage in percentage. So with this data, we have derived that for the first half of the year, only 43% of the population is protected from measles. So our herd immunity for measles is at 95%. So medyo malayo-layo pa po, no? Hopefully, we can get on the right track, no? And mag-ramp up pa po siya, no? Because if we double this number, it will be at 86%. So we are still lacking 9% po, no? Actually po, our January to July measles risk assessment is at 50% na po, no? So we still need 45% po to achieve the herd immunity for this year. So in comparison, for the fully immunized children from 2021 to 2022, so the following data just shows the comparison of the accomplishments, monthly accomplishments from January to June. So the data shows the comparison of 2021 and 2022. So from the month of January to June, 2021 data has a higher accomplishment except for the month of February. So the following is a comparison of the fully immunized children of the first half of 2021 and the first half of 2022. For the first half of 2021, our accomplishment of fully immunized children is at 23.9%, while for this year, our first half FIC, as discussed earlier, is at 21.6%. So we are down for about 2 to 3% pa po, no? But this will increase pa po, no, because of the influx of the data po of the previous months pa po, no? So currently, for the as of August 15, our fully immunized children is at 23.8% na po. So for the following slides, we'll be discussing the issues discussed during our program implementation review. So last May, we conducted the region conducted a program implementation review where different issues were discussed. So one of the main issues that were discussed was the data of the children vaccinated in the private sector po, no? So to start with, the private sectors, including the hospitals, the clinics, including lying-in clinics po, no? And the local government unit health offices had been working hand in hand for the longest time. So the relationship of both parties is essential and integral po, no, for the implementation and for the maintenance of the optimal health of the community. So if ito pong relationship po ng dalawang parties na ay mawawala, so it will be a big problem po for the involved community. So with that, the National Immunization Program, specifically of Region 4-A, and the Philippine Pediatric Society of also Region 4-A, has been in constant communication naman po na regarding the updates or different issues po, no, that arises from time to time. So we would like to take this opportunity to relay the issues voiced out, no, voiced out by the healthcare workers, from the from the different BHS or RHU, Rural Health Unit, or Barangay Health Stations. So one of the issues discussed was the data of the vaccinated children are not fully disclosed po, no? So in order for us to include the vaccinated children po, so kailangan po kasi, no, yung may specific details po na kailangan, no, na sinusulat po sa tinatawag namin na target client list. So yung target client list na po ito, no, so dito po kasi nakabase kung sino po yung mga i-include natin sa fully immunized children. So ibig sabihin po, kung wala po sila sa listahan doon, hindi po sila masasama sa fully immunized children natin or sa accomplishment natin. So bawas po iyon sa percentage natin, no? So what we proposed last June po, no, so we had a meeting with PPS-STC Southern Tagalog chapter po, no. So they were very cooperative and receptive naman po. So we would like to propose to make a memorandum of understanding. So ano po ang i-include natin dito? No, so for the following slide po, no, so I will be discussing the concerns voiced out from the LGUs po, no. So yung mga nakaka-experience po first hand sa mga caregivers ng clients natin o ng mga bata po. And second column, I will be discussing the concerns from the PPS side ng STC po, no? So ito naman po yung mga nakita nila na naging problema na vino-voice out naman po sa kanila ng mga healthcare workers. Vino-voice out sa kanila ng mga caregivers ng mga clients or ng mga bata po, no? So, from the LGU side po, so yung data needed for the TCL, as I have mentioned earlier po, no? So, hindi po naibibigay lahat. Minsan po kasi nabibigay lang is initials, or not the full address, and etc. po, no? So, yun nga po, as discussed earlier, again, sorry, may mga data po na kailangan talaga, no? For the child to be included po sa fully immunized children natin. So, another is, again, this is, some po, no? So, pili lang, hindi naman po lahat. May mga nag-a-advise daw po na wag i-avail yung vaccines from our health centers kasi po, hindi raw po gumagana yung vaccines natin from the health centers po, no? So, ito po ay galing po, no? First-hand experience po ng mga healthcare workers natin, no? Na sinabi daw po sa kanila ng mga caregivers ng mga clients. From the PPS-STC side naman po, no? So, we have this big issue, no? Yung regarding po sa Data Privacy Act po, no? So, kasi syempre po, pagbibigay po natin yung data ng bata, baka ma-alarm po yung mga caregivers, parents ng mga bata kung bakit ibibigay. And second, syempre, in protection din po, no? Sa mga doctors natin na magbibigay ng data. Second po, general practitioners are not included in the society. So again, this is composed of pediatricians lang po, no? So itong problem naman po ito, we are trying to coordinate po with the different societies of the region po, no? So another issue voiced out daw po is no personnel, vaccines, and schedules daw po sa health centers na pinupuntahan. So minsan pumupunta daw po sa health centers, walang mag-accommodate, wala pong available na bakuna, or wala pong schedule po, no? So, another is, may nag-offer daw po ng vaccines, no? Not included in the routine immunizations of health centers. So, may issue din po dito. First po, may mga nagpapabayad daw, no? Na dapat hindi po nangyayari. And another is the proper storage of the vaccine. Siyempre po, may cold chain management tayo na tinatawag, which is the proper storage of vaccine po, no? So, ito po isa nilang concern. Baka mamaya po, yung binibigay po nilang vaccine ay hindi po properly stored. So, hindi po effective. Mawawala po ang potency, no? So, these are some issues and these are the issues and concerns po, no? That we'd like to talk about so that we can include it po sa memorandum of understanding natin na gagawin, no? So, regarding pa sa issue ng Data Privacy Act, so while recording this video, so I had a discussion earlier po with the legal department of our region. So hopefully he can attend the meeting po, no? So he can answer some questions po regarding the Data Privacy Act. Pero based on what we have discussed po, so we have the Republic Act number 11332, or the Mandatory Reporting of Notifiable Diseases and Health Events of Public Health Concern Act. So this was taken from the DOH site po. Source is written down below. So mahaba po siya, no? So I just pointed out some important facts. Some important details po, no? Na hopefully might answer or might support our question regarding the Data Privacy Act. So, based po sa Section 3 ng RA 11332, tama ba? Yes, 11332. So, one of the objectives po nila na I'll just point out or highlight the relative information po for the discussion. So, to ensure the public health authorities have the statutory and regulatory authority to ensure the following. So, one of which is rapid containment and implementation of measures for disease prevention and control. So, in part po of the NIP, pasok po sa disease control. So, bibigay po natin yung definition ng disease control later on, which was also taken from the Republic Act. So, another po objective is to require the public and private physicians and others written below to actively participate in disease surveillance and response. So, papasok po tayo dito sa disease response, which on the following slides po, ibibigay po natin ang definition ng disease response. So, ang disease control, as mentioned earlier here po, in this slide. So, disease control is defined as reduction of disease incidence, prevalence, morbidity, or mortality to a locally acceptable level of as a result of deliberate efforts and continued intervention measures to maintain the reduction. So, paano po papasok sa NIP to? So, kailangan po natin ng whole picture, no? Yun naman po yung gusto natin lahat. Whole picture po ng region ng measles status natin. Actually, hindi lang po measles, no? Lahat po ng vaccine-preventable diseases natin, pero with utmost importance to measles, kasi alam naman po natin na siya po ang pinaka-transmissible, no? So, para malaman po kung magko-conduct ba or kailangan po bang habulin, no? Kailangan po natin nung accurate data nung accomplishments natin. So, dun po papasok yung mga data ng mga bata na nabakunahan po, no? Kaya kailangan po natin sila. Another definition of terms po, no? Definition of term is the disease response. So, mahaba po siya. So, just to highlight the relative matter po, no? So, this refers to the implementation of specific activities to control further spread of infection, outbreaks, or epidemics, to prevent recurrences, part of which is to conduct prevention activities. So, again, as discussed in the previous slide po, no? So, kailangan po natin yung actual data ng accomplishment natin, no? Para malaman po until when or kailang. Actually, kailangan po natin gumawa, no? Ng catch-up activity, which is ginagawa na po namin ng action, no? So, ayun po, kailangan po natin ng reliable data para malaman po natin ito bang ginagawa natin, nakakatulong? Well, hopefully nakakatulong naman po siya, no? Pero up to what extent po, no? Ganong karami pa po ang kailangan na bulin. So, doon po natin malalaman yan, no? So, malaking percentage din po, we think, malaking percentage din po ang madadagdag natin, no? Sa fully immunized children or percentage po natin. Which again, to what both of us want naman po, which is to present the whole picture of our region po in terms of the vaccination rates po. So, in line with the issue discussed po, so we can give report forms po, no? So, actually, we made a sample po ng Google link, no? Yung finifilapan po, Google form. Kaso, pinakita po namin sa mga ibang physician po, no? Medyo nahihirapan po sila. Fill up yun, no? So, syempre po, gusto natin yung pareho po na maganda sa atin, no? Yung pareho pong walang masyadong nahihirapan. And of course, at the same time, makuha pa rin po yung data, no? So, our office made a form composed of the following parts po, no? So, ito pong mga parts na to, yung mga kailangan na data na nilalagay po sa target client list. So, yung target client list po, yun po yung na-discussed earlier na ginagawa pong basis for the fully immunized children or accomplishments po. So, we can discuss naman po kung paano po ito i-fill upan. So, pwede pong, may nag-suggest po, no, na pwede pong may pumunta from DOH sa mga private sectors to get the data, no. So, also part of the discussion po with our legal department, no, pwede rin po tayo gumawa ng waiver na pwede ipasign sa mga caregivers, parents, and etc. po, no? Na magbibigay po silang data. So, naka-state po doon bakit kailangan yung data, anong importance po ng data, and other important matters po. No? So, and the second issue po, so, I think medyo discussed or nadaanan na po earlier, no? Sa ang divided support daw po sa immunization program. So again, this came from the healthcare workers po, no, na nakaka-experience firsthand. Meron daw po kasi minsan, no, hindi naman po lahat na sinasabi na wag daw po sumama sa bakunahan ng health centers, DOH, etc. So yun po yung mga naiparating sa amin, no, ng mga nagbabakuna po, no. So ayun po, ginagawa naman po, no. So maganda lang din po na masama sa Memorandum of Understanding po na hopefully magawa natin na give support, full support to the programs of the Department of Health, in particular po itong routine immunization and catch-up programs. And ayun po, participation in the catch-up activities po, no? So hopefully we can discuss later on and we can agree before this meeting ends po na kung anong pwede natin gawin. So before we end this presentation, I would like to leave this quotation, no? We all have a common goal and we know it's all for our future good. So thank you po. Again, I'm Nicholas Santos, or Nick, the NIP Medical Coordinator from Region IV-A. So thank you po.